now my pleasure to introduce Neil Fraser. Neil is the president of Medtronic Canada and the regional vice president Canada for Medtronic. He is the chair of our advisory council. We are ever so thrilled and honored to have him in the chair position for our centre. He's also a member of the Advisory Board for Life Sciences Division at the National Research Council of Canada. He's a co-chair for the Centre for Advancement of Health Innovations at the Conference Board of Canada, and just recently appointed to the Ontario's Health Innovation Council. So Neil, it is a pleasure to welcome you to the podium.
Good morning, everybody. We're very proud as Medtronic to be a sponsor of both the Reverse Innovation Challenge and of this meeting. So we look forward to hearing about some great ideas that people are coming forward with. This year marks the 5th anniversary of this institute, and at this particular juncture, we feel it's very important for us not only to look to the future, but also recognize contributions of the past. At this particular time, we would like to recognize our founding chair, the Honourable Kellie Leitch, who is sitting in front of me here, who is the Minister of Labour and the Minister of the Status of Women. As many of you would know, Kellie has an extremely impressive bio. In July 2013 of this year, she was just appointed as Minister of Labour and Minister of Status of Women, but previously was appointed Parliamentary Secretary to the Minister of Human Resources and Skills Development and to the Minister of Labour in May of 2011. She is also a practicing pediatric orthopedic spine surgeon and associate professor of surgery, served on various councils and boards, including the YMCA and Community Living. She was a council member of the National Research Council of Canada and a board member of Genome Canada. As I mentioned, the director of the YMCA, the Toronto Board of Directors of this. She's vice president of the Canadian Foundation for AIDS Research and also a founder of the Sandbox project, which focuses on children's health issues. She first earned her doctorate of medicine from the University of Toronto in 1994 and an MBA from Dalhousie University in 1998. Dr. Leitch has been recognized with the Order of Canada for her advocacy work on behalf of Canadian children, and she actually led a committee and published a report on child health in Canada. She was also a member of Canada's top 40 under 40 for her work both in medicine and business. Dr. Leitch lives in Clearview, Ontario, is the MP for the riding of Simcoe Grey, and in addition, she was the founder and first academic chair of this center of the Ivey School for Health Innovation. Minister Leitch has championed innovation in our healthcare system, both as part of the Centre and as a member of the Federal Parliament. Dr. Leitch, you're truly an inspiration to current and future leaders and bring a unique interdisciplinary perspective that is of very significant value. We believe at this 5-year anniversary of our Centre, your commitment and leadership deserves a unique recognition. So on behalf of the Advisory Council of the Centre, we'd like to invite you up to the stage to accept a plaque in honor of your dedication to innovation in health systems. Dr. Leitch.
I'll try not to drop it on the ground. Thanks.
Make some comments?
I'm going to make some comments.
You can just put that right there.
This box is large enough that if I stand on it, you might see me over the podium. Thanks very much, Neil. I have to say, I was not expecting to get a plaque or anything else this morning, so I'm going to punch Ann Snowden at the end of this. You're in heels. She said that I have to catch her first, which I will easily do. That I can assure you. It's great to be here this morning. As I've said to many folks, I'm a pediatric orthopedic surgeon. That's my day job. I've been very fortunate to have some other opportunities. I usually speak in a room with two people, both of which are asleep, the patient and the anesthetist. So this live room audience expectation is, well, if I speak too fast or, mumble, please, I beg your forgiveness. Thanks very much, Neil. Appreciated, even though surprised. And also, thanks very much to Ann Snowden, the academic chair, as well as Laurie Turk and your outstanding team. Congratulations, everyone. Ann had said to me to convince me to come here this morning that she wanted me to talk about the inception of the center. And I will do that because my staff wrote me a speech about health innovation and science and all those things. But Gary Goodyear, who's the guy you really want to meet in this room, I'm going to get him to stand up. This is the man who actually does science and innovation for the Government of Canada. And he is outstanding. And he really is the guy you want to talk to. If you have a great project and something that you want to take from the bench to the bedside. My time as the first academic chair for the International Center was something that was quite rewarding for me. It was an opportunity to be involved with a wide number of students, but it also was a great time for my father. I had spent 16 years in post-secondary education and then 10 years as an academic. So when I got off the dole and got a real job, he was actually really pleased. And but a number of people have asked me how the center came to being, what the idea was. For those of you that are physicians in the room, you can truly appreciate being a resident and toiling away. Most junior residents spend about 100 hours a week in the hospital. We're called residents because you actually used to live there. They let you go home on occasion now. The challenge with it is that there's a lot of busyness and not necessarily a lot of productivity. It's particularly pronounced when you're a junior resident. You do stuff that's called scut. And as a junior resident myself, I was accepted into a program here at the University of Toronto in orthopedics where it was mandatory to do 1 or 2 years of a master's degree. And I thought that I have ADD as an adult, and I thought that sitting at a bench would be too challenging. I wouldn't be able to sit at a lab bench and actually be able to look at a petri dish for 2 years to actually achieve the goal of my professors. So I asked to do an MBA. And I did that because I thought that there were needs in the healthcare system for innovation that we were not truly realizing. And I was fortunate enough, the Dean of Surgery here, John Wedge, who's the chair at Sick Kids in Surgery, decided that it was a bit of a bet that he was willing to take. And so I completed my MBA, was able to come back after my residency, and was hired at Ivey as an adjunct professor. But Carol Stevenson, who was the former dean at Ivey, she just finished her tenure in September, had the courage to actually invest in a young person and look at what we could do as a center. And then the Government of Canada thought that this was a great idea, actually under the leadership of people like Gary Goodyear, who's here today, to decide that taking things from the research development phase into the innovation and commercialization phase was what the Government of Canada really should be investing in. And most importantly, investing in young people like yourselves in the room. Making sure the young Canadians or young people that choose to come to Canada to invest in our country were being supported. And the best way to do that was through an academic institution with an outstanding reputation, but one that was willing to put healthcare in the same room as business, to put aside the concerns that other people may have with regards to how we deal with healthcare and really focus on how we can innovate in the country. Now, business schools, it's not uncommon for them to now be thinking and talking about healthcare, but this idea was a bit unique. But it actually was able to be brought into what was really the core values of the Canada Health Act, preserving the issue of making sure that patient care was first and foremost, but having an innovative spirit of commerce. And so that's how Anne asked me to explain sort of where this idea came from. That's where it came from. And I'm delighted to say that I think that we now have multiple graduate students. It's good that Ann Snowden is now the chair. She is a true academic. I would never, ever focus on these things. And be able to achieve the things that the center has been able to achieve, and I hope we'll achieve over the next 5 years, 10 and 15. Now, I'm also fortunate to be part of a government that truly focuses on research and innovation. We lead the G7 in higher education research and development in our share of the economy, and it's one of our key priorities. The Government of Canada invested over $9 billion in science and technology and innovation over the last number of years, which includes $5 billion in advanced research, education, and training, and $2 billion in infrastructure. And Minister Goodyear, I know, will focus more on what the specifics are, where you can become involved, and how you can have your projects augmented so that they are contributing not only to what you're doing as a researcher, but also to what you can do to aid us and the Canadian economy to make sure Canada is prosperous in the future. So I'm not going to get into those details. One of the things, though, I will talk about, because this is what my actual hat is, in addition to the innovation side, which I think we've all seen great strides in. I see it every day in my practice. I'm still practicing. I can't tell you how lovely PACS is. Do any of you know what PACS is? Am I talking in language even you don't know? That's scary, actually. So we used to carry around X-ray bags. That's why I have big biceps at this size. But they were put on digital. It was really revolutionary, I got to tell you. But the concept of doing something that simple, just simply uploading digital X-rays, is something that not only has saved me from feeling like a weightlifter, but actually makes X-rays available to all physicians. So I can't tell you the number of times I ended up in an operating room as a junior staff and asked my resident, where is the X-ray for this individual, and had to do another one. Or how many times I'd be standing in an emergency department and say, where's the X-ray, so we can make a clinical decision, and we didn't have it. Now those challenges are gone. It provides much better and expedient care for patients, and it's something exceptionally simple, right? We see the same in my field in arthroscopy. I don't know if any of you are old enough in the room that you actually had a knee replacement done or had one of those great big long scars about this long in the front of your knee. We now make 3 little holes. Any of you who went to go to see a physician right now and aren't offered an arthroscopy would probably look at the orthopedic surgeon like we were crazy. It's something that's revolutionized patient care. But one of the things that we also need to do is make sure that we have the individuals to provide this care, but also the innovation side and the business side. And so, as I say, my other most new role is I'm the Minister of Labour, but also the Minister for Status of Women. Since 1991, 60% of graduates in undergrad have been women. But we see, if we look at the statistics, how underrepresented they are in science, math, and technology roles. And this is something that has to change. In Canada last year, over 250,000 skilled trades jobs, skilled jobs requiring science and math, went vacant. So we have an unemployment rate in this country of 7.2%. Over 250,000 skilled jobs went vacant. If you look at the numbers of where you can find individuals that are available to fill those roles, we talk often of new immigrants, we talk often of various different ethnic groups, but the largest absolute number in the country are women. They're well educated, they all have at least a high school education, if not college or university. As I said, 61% of our graduates in 1991 and since have been women. Our largest absolute pool are women. Those of you who are in this room have an interest in science, math, and technology. We need all of you, men and women, to encourage young women at the dinner table, when you're talking about what you will do for your future education, to talk to them about entering into engineering, taking on a skilled trade, making sure they're interested in science and technology. Because if we don't start that dialogue now, we actually won't have the pipeline of students we need for the future. At Status of Women Canada, we've invested in about 600 projects in the last 5 years. But we're just making a tiny dent. It actually takes the word of mouth of all of you in this room to do that. And I'm delighted that Ivey's numbers have changed. The HBA program has a significant number of young women in it now. I know it started at about 5 or 10%, is now up to over 35%. 40% on last count in the HBA program, and the same with the Master's Science program that's matched with the HBA program. But these numbers can't be the only ones in the country that are escalating. So we need your help. We need you to talk to your friends. We need you to talk to your children and make sure that these young women are entering into jobs that will help fuel our economy. Because our #1 issue in this country is we have great, smart, brilliant people like those of you in this room, but we need people to fill those roles. and we need them now. By 2020, we'll have a deficit at this rate of 1 million people that we need to fill skilled roles. This is the challenge for the country, and we need your help to help fix it, because we need people to be in the right roles in the right places at the right time so that we can grow our economy. And a big part of what our government's focused on, and I know Minister Goodyear will speak to this significantly, is making sure that we have the right people who have the skills in science and tech, who understand about the research and development side and moving to the innovation and commercialization side so that we can grow the country. So I know this has sounded as long as it seems, and it was a lot longer than the Dean's speech, which I have to say was very succinct. But delighted to be here today, and I hope you have a great conference. Congratulations, Anne, Neil, Laurie, for your outstanding success. And I look forward to hearing what Minister Goodyear is going to tell us so that I can innovate my next robotics project.